Everybody. Okay, we're live. Hey, everybody. Thank you for joining us tonight as we hold a discussion on COVID, mental health, and parenting. I am Hope Harmon. Thanks so much for joining us at Act for Change with Hope Harmon. I'm a change agent, elected official, and an advocate for everything that is pretty much right. Living in South Georgia through open and honest conversation, my goal is to help change mindsets, perceptions, and call people to action. So tonight we have MJ Larkin with us again. She is the owner of FaithWorks Coaching and Counseling LLC. She is APC, right?
Yes,
APC.
ma'am.
So, and we are really excited for her for that. She offers several different services, workshops, and classes. Make sure you follow her on Facebook at FaithWorks Coaching and Counseling LLC, and also follow her on Instagram at The Single Mommy Therapist. So the inspiration for this live tonight is, I think it was 2 weeks ago now, we had a discussion on COVID, mental health in children. And we talked about like what have the effects been on children as far as COVID, isolation. And we had a few people to actually say, hey, what about the parents? And it was something that was kind of already in my mind to do. I had already talked to MJ about it. So, we wanted to hop on because we're both parents and we can kind of talk about some of our personal experiences, but MJ is going to bring in her professional experiences as well. And so if you have any questions, make sure you leave them in the comments, and we'll get to them probably later in the live. But just sit back and we hope you learned something tonight. I know I'm going to be learning as well. Right. So we're going to start with, once again, what is mental health and how can we as parents make sure we are mentally healthy for our children?
All right. So mental health is the regard to a person's psychological and emotional well-being. So basically everything that makes up who we are holistically. As parents, a lot of us have taken on different roles. So we went from just being mom and dad, or either chauffeur. Now we're teachers. We're the lunchroom staff. We're everything. The biggest thing that we can do as parents is to recognize when our body is telling us, "Hey, I'm tired," and to honor that instead of feeling guilty or feeling like, I can just be a machine. For women, the superwoman syndrome, which is I can handle it all. I got it all. I don't need any help. Don't ask me if I need any help. You're not going to ask for help. But the downside to that is people are asking for help, and your body is telling you to like take a break. And, if you're finding yourself staying up all night, sleeping all day, taking extended time on homework. And then if you're in school yourself, or if, your work hours are opposite of kids' school hours, that's very difficult because, again, it's that work-life balance that's not being achieved. So to circle back around, just make sure you're listening to your body, and listen. If you don't, your body will. And definitely don't want to be in a position where you shut down and then you can't do anything. And it won't be by choice. It'll be because you have no choice and you didn't take heed to the warnings.
So MJ works with children. And so what have you seen in the field are the effects of the pandemic on parents?
That's a loaded question. Okay, so I work with children, but I do have colleagues that see adults as well. We're seeing an influx of adult referrals, especially for substance abuse. So one thing that we are seeing in particular in the field is the increase of substance use by parents, whether it be illicit drugs or they're turning to alcohol. People are looking for different ways to cope. And so we're finding that we have a lot more adult referrals because everybody's like, I don't know what else to do. And the drugs aren't working, or the alcohol isn't working, or either they're being mandated to services because of a DUI or because of a charge. And nobody wants that to happen. Of course, for that to be a reason for a referral. But however, if you're looking for other ways to cope that are not healthy, then that's another problem. But people are just, like I mentioned, people are just looking for different ways to cope. And we're seeing a lot more, parents bring their kids in. Oh, my son or daughter has this issue. But then when you get them in there for the assessment, it's like, we think you should come in too. And,
Right.
and that's the thing that I drive home to all the parents of the kids that I see, that, once you start working on you, then your child starts to work on them. Because believe it or not, just the same way that, we worry about our children worry about us as well. So it's very important to take care of yourself and be mindful when you are indulging in things that are not healthy.
So, I know we talked some about like the effects of isolation on children, but what are the effects of isolation on adults?
It's the same. I mentioned a couple of weeks ago, we're seeing an increase in depression. Suicide rates are through the roof. Substance use is through the roof. Let's see. I think I mentioned suicide is through the roof as well. It's just very impactful. And so you want to be mindful, because isolation does lead to depression and anxiety. And that's why it's important as a parent to build community. Unfortunately, today in the society we live in, we get this image on social media that you can do everything yourself. It's me, myself, and I.
Mm-hmm.
I can do it all for my children. I don't need, any help. But that is so not true. That's the furthest thing from the truth. So you want to be mindful when you start to notice that you're spending a lot more time by yourself. And there's nothing wrong. In the same breath that I say that, it's nothing wrong with spending time by yourself, working on your healing, building your strength and endurance and everything. That's fine. But when it starts to impact on how you engage socially, like with your friends, family, or with your children, that's when you need to be worried. So please, if your friends are reaching out to you, please talk to them, at least one trusted individual. And if not, then you can always, there are several directories. Please reach out to a professional so that you don't have to go through this alone.
I know you mentioned suicide, and I know this is one of the questions, but can you just hit on that again about what group we're seeing more an increase in those suicide rates in? Because I think people really need to know that these things are rising, and they are seemingly rising in specific groups.
Yeah, well, right now we're seeing a rise. Actually, over the last couple of years, we've seen a rise in Black boys ages 10 to 13. That's definitely on the rise. Actually, it has more than doubled in the last couple of years. Now, overall, more men are likely to complete suicide because they engage in lethal means, like they use weapons such as shotguns, pistols, whatever. Women, however, it's pills. You've even heard some women like drive their car off into the lake, but men use more lethal means. So men are more likely, per research, to commit suicide and actually complete it. But if we're talking about a particular group that's on the rise, it is Black males ages 10 to 13. And
Wow.
there's so much research as to why that is. And a lot of it is attributed to the environment, what they're brought up around, who's in the household, traumatic experience that they're not able to share. It's a host of things. But you want to be mindful that you are checking in on your children, because we're in the middle of a pandemic. All of us are going through it. And sometimes kids get pushed to the back. And so as parents, sometimes we can assume that kids just know, but they don't. So it's really important to not just check in on yourself, but make sure your children are good as well.
Okay. And I just really wanted to drive home that point because I think more and more, those suicide rates are just something we just gonna really have to pay close attention to, and also just have more open and honest discussions about suicide, and encouraging our young Black boys to talk, to let us know what's going on, to find them a safe person, that we need them here. So what getting back to the adults. So what are some signs of depression in adults? Like if I'm an adult and I kind of don't know, I'm just feeling a little funny these days. What are some things that I maybe can say, oh, well, this may be something I need to go get seen about?
Well, definitely a change in behavior. If the biggest thing, as far as like diagnosing depression, is the loss of interest in anything like socially engaging, eating, a change in routine. Now, it's okay to, decide like, hey, when the pandemic, I'm not going to be as social as I was, to protect myself and protect those around
Right.
me. However, when you start to isolate or just start to not feel like yourself, definitely reach out. It's really hard to pinpoint like certain signs because everyone is different. But the major things are like feelings of loneliness, suicidal thoughts. Of course, that's a major one. And the biggest thing is time. So a lot of people say, "Oh, I'm depressed," but when they go see the psychiatrist, they're like, "Oh, how long have you been experiencing this?" And it's like, "Oh, 2 weeks." And it's like, that's just being lonely, or there could have been a major life transition. Now we know that certain things in life, such as a loss, it could be a death, change in routine, a loss of a job, pet, or anything that can trigger feelings of sadness and loneliness. And that can also trigger depression. However, it's very important before you diagnose or start claiming certain things that you do see a licensed professional. And that's the thing. LPCs, licensed professional counselors, can diagnose, but we cannot prescribe medication. Now, if you are seeking help from an LPC, you want to make sure that they have some sort of relationship with a psychiatrist who can prescribe the medication. I'm a big advocate for going to see a counselor before you go see your doctor or your nurse practitioner, because they often just treat symptoms, not the cause. So it's very easy to go in and say, "Oh, I've been feeling like this. I haven't been feeling like myself." And then next thing you know, you get a prescription. Please speak up. If you go to your physician and you do not want medication, it is your right to ask for a referral. That's your right. You can refuse it. I get it. We talked about this the last time. It can be intimidating to talk to someone in a white coat or in a certain profession, because it's like, oh, well, they know. Well, that's okay. And they do, they're professional, but you know yourself too. So if medication is not the route that you would like to go, you can always ask for a referral. And then you'll go through a host of assessments, and then you can go from there as far as like medication and what's the next steps in your process.
And how can because like you were saying, like the doctor is always like seemingly the first person a person would think to go to when they're seeking like a mental health professional, LPC. So like what are some ways that parents can find a mental health professional on their own? Because I think that's really important to know too.
If you are with a company, you should have an EPA, which EPA is good. That's Employee Assistance Program. So if your company has that, whether you're part-time or full-time, you can still tap into that resource. Now, you do have a limited number of sessions that you can meet with your therapist or whoever you choose to see. There are a host of other directories such as Therapy for Black Girls, Psychology Today, and it's another one. Oh my goodness. I'll just say it like this. You can simply type in Google and say therapist near me. But
Right.
psychology today is going to be your best bet. If you aren't employed, psychology today is going to be your best bet. You can narrow it down based on ethnicity, treatment modalities, radius, so that you're not having to drive to Atlanta, to have to meet with somebody. But due to the pandemic, if you are in the state of Georgia, you can see any counselor anywhere in the state of Georgia virtually. Just a lot of counselors also have sliding fees now because of the pandemic. So if you're looking for someone specific, that might be something you want to talk about in your consultation. But those two are, like I mentioned, they're the first two off of my head, and there are a plethora of therapists out there waiting for you.
And also, if you don't have insurance, please don't think like therapy is not something that's affordable, because it honestly is. Talking to some of these therapists and different people I know, like the fees really aren't high at all. You just have to talk to them and ask them what's their rate for, and you can go from there. And a lot of some employers have even gotten with their insurance companies, and there's no copay right now. So you don't even have to worry about paying for a copay. All you really have to do is find somebody in your network that your insurance will cover, and you can just you can start setting up sessions. It's just really and truly
Right.
easy. It really is. And I honestly would not have known that if my personal therapist would not have told me. She said, she's the one that told me a lot of, and I'm a huge advocate for therapy. I will advocate for forever. So I want to talk a little bit about family therapy. Kind of explaining what family therapy is, kind of when it's necessary. And I also would like for you to talk a little bit about if a child is already in therapy, how parents can set up those family therapy sessions and actually get seen by some providers for free through that as well.
Okay, so let's go backwards. I'll start with your last question first. So
Okay.
if your child is seeing a provider through a state agency, when you go for your intake session, let your assessor know that you would like family sessions. Now, for billing purposes, you have the option to have family therapy with your child or without. I honestly think in some, depending on the situation, it's better to hold a family session without the client, just so that that your therapist can get a better idea of the family dynamic before the client comes in. What family therapy is not. It is not a bashing session. It is not the opportunity to put your child down, your spouse down. If you're co-parenting, it's not an opportunity for you and your partner to put each other down, because that's not productive. Family therapy looks at the family as a whole. So in some providers, again, like Hope mentioned, you will be able to go into session with just you by yourself, or you, and if you're married and this is not your child's father or mother, you and your spouse or your significant other are able to go into those sessions and just again have those hard conversations. When is family therapy necessary? Anytime there's a breakdown in communication,
Right.
when there may have been like a traumatic experience that the child is not comfortable with expressing, the therapist can act as just someone who is more than a mediator, but just someone who is an advocate for the child to be heard. What tends to happen in family therapy, sometimes it does feel like you're a referee. But that happens in family. All family dynamics are different. So if you or your spouse or your significant other, if you're interested in family therapy, please do, schedule that session. But like I mentioned, it's not an opportunity for you to run down your partner, their parenting skills, or anything else in that session. It's really to kind of identify, like, okay, what are the barriers in the relationship, the family as a whole? And that's something we often have to explain to first-time clients. And it's okay if things come up. That's fine. That's expected. However, it's not a bad session. But we can again help develop those communication skills so that we are able to have healthy conversations. Conflict is healthy. It can be healthy if done in the right way.
Yeah, and I think that people need to, definitely understand, like, when you go into family therapy, you really have to keep an open mind. Like, you cannot go in there and be defensive. You can't go in there and think, I know it all, that I am the one that is right. You really have to keep an open mind in those sessions, especially when you're in there with children, because your
Right.
children may get in there and tell you some things that they would not tell you any other time. And if
Right.
you get in that family therapy session with them and you shut them down, then they're not going to share anything else with you more than likely. You know,
Exactly.
you have to keep an open mind. It is not, nobody's attacking you when you go into those sessions. It is honestly just having an honest conversation where everybody can get their feelings out, have a clear
Yep.
understanding. And I think that sometimes children, especially, are more comfortable talking in those environments. And you never know, that may open up that barrier between you and your child. So y'all may
Right.
have a better line of communication going forward. So
Yes.
once again, everybody, if anybody has any questions, please make sure you put them in the comments or inbox me, and I can send them to MJ, and we can follow back up with you. Either whichever makes you more comfortable. So, should parents talk to their children about their mental health and about what they're going through?
Um, so I'll say it like this, like we were talking about earlier. I think it's important to educate your family, so that they know how to support you. Oftentimes, again, as a parent, it's very easy to go through your own thing and just share with anybody, or just assume like, oh, my child is too young, they won't understand. That's not true. Like I mentioned earlier, the same way that we, as parents, we worry about our children, they worry about us just as much, if not more. So I think it's important to educate your children. I think it's important to educate your children on the fact that you're not a machine, and you do get tired, and you do need help as well. If you are not familiar with your diagnosis, if you're not familiar with schizophrenia, bipolar disorder, depression, anxiety, or you're just tired, and you don't really know how to articulate that, just you can again educate them on your needs and how they can support you. For example, if you need a break and your children are older, maybe 10 or older, because they do have a better understanding. But I do know some smart 6 and 7 year olds too. But if you're able
Oh,
to have that conversation, if you're able to have that conversation and say, hey, listen, when mommy shuts that computer down, I need 10 to 15 minutes to myself so that I can be healthy for you. And I get it. It's not going to happen overnight. No, they're not going to understand, and they are going to come and ask you, what's wrong? Did I do something wrong? Again, you want to make sure that you educate them and just reassure them that, listen, this is me, this is not on you. The unfortunate part is that we have some adults now that have gone through some experiences where their parent had a mental health illness, a mental health disorder, or they were just experiencing anxiety or whatever the case may have been, and they grew up internalizing things. And so now we have a whole group of adults that have issues with, rejection, validation, constant reassurance, a host of other things, all because there was no conversation. And I get it. If you don't know how to say it, then you don't know how to say it. But again, it's important to educate your kids, educate your support system. If even if you're not comfortable with talking to your children, please talk to your community of support and let them know what you having an episode looks like, so that if your child calls them and they're not freaking out, so they already know what's going on. I just think communication is really big. And again, I don't suggest, unless you have older children, that you give them like your formal diagnosis, unless you are just really comfortable with sharing that, because younger kids, they may not understand, right? But the older ones, they can get it, they understand. Even if they don't understand everything you said about your diagnosis, they understand, okay, this is how we can support our mom or our dad. And that's important too, because it helps take away the mom guilt or the dad guilt. So yeah, communication is
oh,
key.
and since you mentioned about the mom or the dad guilt, can you talk about parent guilt a little bit as well? Because I mean, that's a real thing, and I don't think people understand. Understand that's a real thing. It really is.
Yes. Parent guilt can keep you, running ragged, okay? Especially if you're a first time parent, it's very easy because there's a lot of pressure on you. You have this new human being, and you have all this advice around you, or the opposite, or you don't really have the support that you would like to have. And so you're kind of just winging it. But parent guilt is very real. very real, but it also has an impact on the way that you treat yourself. So you want to be mindful of that. Again, like I mentioned earlier, you want to recognize you are not a machine. You do need rest. You need time to yourself. Even if your support system is not, again, that big or, present, talk to your children. Let them know, set those boundaries. Hey, when I'm done with work or when I come in, I need the first 10 minutes to regroup and reset. It's very easy to transition from work to more work. And so it takes discipline to be disciplined as a parent too. But I am here to tell you, please give yourself permission to enjoy your life. I hear so many parents say that, they're waiting until their child gets older to enjoy life. We're not guaranteed the next day.
Very
And I just
true.
wanted to throw that out there. We're in the middle of a pandemic. We don't know when anything is going to go back to anything or when this thing is going to go away, but it should not determine your quality of life. There's joy in the simple things. Again, don't beat yourself up. Parent shaming is real. Please no parent shaming because it's already hard enough. But we all have done it in some way. Whether you saw somebody in the grocery store and the kid was running around screaming or, just any other instant. You want to be mindful about parent shaming as well. Parent shaming and parent guilt, you know, it just really determines how a lot of people what they do with their children. It's that persona like, oh yeah, I got it, but you don't. And it's okay if you don't. Um, so don't allow parent guilt to keep you from living your life. You can be a mom and still have fun. You can be a dad and still have fun. It's good to go on trips with your family, but it's also good to go on girls trips or guys trips or trips by yourself.
Ooh,
Don't neglect
I love
you.
a trip by myself. I love going somewhere by myself. I don't, it doesn't, but I've just gotten that way in the last few years where I'll be like, I mean, I'm gonna book a room and I'm going to stay on the river in Savannah for a few days,
And you
because
should.
I just have learned like that's my portion. Like, and I need that time to myself if I just want to sleep or if I want to just DoorDash and eat all weekend, or if I just want
Yes.
to sit and watch the river all night long. That's what I can do. So that
That
was a
is
really
your
good point.
right. You can do it.
Exactly. Like exactly. And I think also like that point you made about parent shaming. Parent shaming just ticks me off to up teen because it's
Yeah.
already something
Yeah.
of being a parent. And you have a lot of people out here who don't have any support. You have a lot of people out here that didn't have anyone to learn from in the first place, who have come with a lot of trauma, who are genuinely trying the best they can, and then they have to get on social media and see people talking about what you should and should not do as a parent. And as long as your children
Exactly.
are happy, healthy, and whole, and you are trying your best, do not beat yourself up or let these people on social media trick you into thinking they have everything together. Because I can tell you, social media is half of what we see on social media. Well, I'm gonna say 75% of what we see on social media. It's just not real. Like everybody's perfect on here, and nobody's perfect. We all make mistakes. We all have
Right.
our we all have things about us. And so please don't let
Mhm.
this parent shaming, this whole thing on social media, these social media people make you believe that you are a bad parent, because you're not. You're trying the best you can. So
Right.
what are
And we're
some
all
things? Yeah, we all learning every day. And by the grace, with the help of God, I'm learning every day. And
yeah.
so what are some things that parents can do at home to kind of ensure that they're taking care of their mental health? I know you mentioned a few of those things in the last answer, but what are some things they can do?
Definitely create a routine. Like I mentioned, it's easy to transition from work to more work. So you want to definitely create some sort of routine from work to rest. Like I just mentioned, if you have children, letting them know that as soon as they hear that laptop close or hear your door open, that doesn't mean that you're open for business just yet.
Right.
Speaking up and maintaining your boundaries. If you know that you're tired, if you recognize, like, okay, I've done everything in the last 24 hours that I can do and I'm exhausted, listening to your body is the most important thing. Also, reaching out to your community and letting them know. A lot of times we'll have community, but we don't use our community.
Very
And,
true.
the majority of our community is like waiting to help. And oftentimes, to be honest, if your community looks at you as like the strong friend, they're not coming to ask you for help. Matter
Mm-mm.
of fact, they will call you and say, "Why haven't you called me?"
Yep.
And the truth of the matter is that you're tired and that you don't have that space, and that is okay if you don't have that space at that moment. You want to check in on yourself. Like I said, create a routine from work to rest. Keep those boundaries in saying no, setting a proper bedtime. You can engage in physical activity. You can even do things with the kids, regardless of if you're in an apartment or if you're in a home, walk around the complex, get out. Um, Even, Morgan and I, we're in the where we are, but it's like, okay, what are we gonna do in our day that we can not only just spend time together, but get out. So I can get up from this laptop and she can get up from her laptop. So we take a stroll around. And that helps. The sunshine helps. It really does. Again, just listening to your body is the most important thing. Not beating yourself up because you didn't do any, what you said you were going to do or keep up with your resolution or whatever. The biggest thing, have grace and have patience. Our parents before us, they didn't know how to rest. And unfortunately, we have taken on some of those same traits. I know I have. I will work until I can't work anymore. So
Mm.
even at my age, I'm learning how to rest. And I hope to pass that on to my daughter. Like, it's important to rest. Like, work is still going to be there, even when you come back. So, making sure, oh, and as far as your, if you recognize that you do need to see a mental health professional, please be mindful that you don't have to go through this alone. Don't get on WebMD and try to diagnose yourself.
No,
Don't
don't get on there
sometimes
at all.
and
Mm-mm.
also be mindful who you share your experiences with too. I know several people that stopped sharing because they shared with the wrong person. And that person made them feel crazy or made them feel out of sorts or made them feel like, oh, nothing's wrong with you. You're just lazy. And they just never share it again. So if that has been, your portion and that has been your situation, that's not going to be your situation with your therapist. It's just
Yeah.
not. And if it is, get a referral and go on, okay?
Yes.
Because that's your business. But but again, my point in saying that is that you are not alone. You don't have to go through it alone. Another thing you can do too, hop on Facebook. I'm not saying live on social media all day, but there are plenty of parenting groups for, I mean, just everything now: single parenting, co parenting, parenting of special needs children. I mean, just all across the board. So, again, like I mentioned earlier, if your community, if it's not very present, you can always find community on social media. Again, there are a host of parenting support groups, and there may even be some near you. And like I mentioned earlier, due to the pandemic, a lot of things are online. So you can follow some therapists on IG, on Instagram, and they are even holding like once a month parent meetings, and it's free, y'all. It is free for a whole 60 minutes. It's free. You can sit, vent, cry, do whatever you need to do, and it is free. And again, it's about building community as well. So then you also get to see that you're not alone in whatever you are experiencing as a parent.
Well, I think like I think parents, I hope everybody took something from this. I'm sorry, I got kind of twisted up on my words, but thinking about what I wanted to say there. But I hope everybody kind of took something from this. If you have any questions, make sure you message me. You can message MJ. Follow MJ on FaithWorks Coaching and Counseling LLC. Follow her on IG at the Single Mommy Therapist. Just parents, just remember you do have support. It is a community out here. I mean, we know the pandemic is hard, and parenting during the pandemic is even harder. And there's so many things going on, so many different emotions, so many. You just don't know what's going to happen from day to day. But just do not feel like you're alone. You do have people who are here for you, but we want you to pray and we want you to seek some counseling as well. And some licensed counseling, people who have been to school to help you along this journey.
Yes.
So please make sure you share this, and thank y'all so much for tuning in tonight. I don't think we have any questions. No questions. No questions. No questions. But if you do, if you just didn't want to post it, don't hesitate to inbox me or inbox MJ directly. She's on Facebook. And we hopefully will have MJ back again so we can have another discussion. Be sure to follow my advocacy page, Kasera's Voice, as we continue to seek justice for Kasera, Aviana, and others who have lost their lives due to violent crimes. Subscribe to my podcast, subscribe to the YouTube channel, Act for Change with Hope Harmon, and make sure you share this with parents, because discussions like this are really, really, really important. And mental health is really important, and that's probably something I'm gonna be talking about for the rest of the year. This is mental health probably every month. So please make sure you follow us on Facebook, so all social media. And thank y'all so much for tuning in tonight, and y'all have a great night.